Hi guys, it's me. I'm back. Not too long. First of all, I'd like to say I'm sorry for that I didn't get some of my facts straight last couple times. I was a little bit mixed up between what the actual people on the front lines as responders and people like doctors and people who are on big committees in this overdose crisis. I know some of these people, and instead of listening to the local um, small-time community-based media, instead I listened to all kinds of mixed up news that was coming in, and and I didn't get my facts totally straight, and I'd like to apologize. But I will give you good numbers today of on the update on the opiate epidemic. My friends have supplied me with some great news, so I want to share it with you. Well, great news. At least it's solid news. So, first, I would like to share that the Comox Valley Record News has recorded that the feds have funded a safe drug supply pilot program for Cowichan, Comox Valley Record. The opioid overdose crisis continues to be one of the most serious public health crises in BC. So now, the feds are, I guess, starting to experiment with this clean dope supply, entering like places like Nanaimo, Victoria, Vancouver, now Cowichan, and eventually, everywhere. And it should take effect very fast. Such a great move from the government is actually, so I think, is going to show very good numbers soon, even though the numbers are still very poor right now, because people are still, getting their money from the government and blowing it on drugs, and the drug dealers are blowing the money on drugs to supply, and blah blah blah, and I've seen drug dealers be super happy because they got the syrup and for several months, a few $1,000s, and I've seen, drug addicts happy because they got money too, because our government has proved to be taking care of us, all of us people, all citizens, pretty good during this COVID crisis. Another one is Vancouver Island Free Daily News reported that nearly 12 people died from overdoses every 2 days in the month of June. Nearly six people died from overdoses each day in months of June in BC as the spike continues. And death toll from increasing toxic drug supply killed 175 people in BC in June. Okay, 175 people in June, 170 people in May, and since March, around 400 people have already died since the month of March. Okay, so about 100 people a month on average, and but once again, people like my doctor, for example, she said that she will conduct an interview with us as soon as possible, because she would like to join the, and have Cambo River, which is her base, also have all these, clean dope supplies and new supplies and new rules come in, and new injection sites come into their neighborhoods and where they are from, basically up and down the island, because that's what needs to happen. But for example, her rule is, which I really back it up, is only monitored and only witness injections in injection sites. You don't let people take clean dope with them, because they're going to end up, spiking it and selling half of it on the street and doing the clean part themselves. You would be surprised how many things people will think of if you let them take clean dope for free out every day, then they will take advantage of you, and for sure. So it has to be monitored and witnessed injections in great environments, with great people. So once again, as you see, I'm okay. I had a few days where I drank, so I'm sorry. I had my little crisis, and I got some numbers wrong last time I recorded, because for some reason my brain immediately validated the overdose numbers as deaths numbers. I forgot to consider that a lot of people are being revived from these overdoses. So overdose numbers don't represent the number of deaths due to overdoses, because a lot of people are getting saved. Hopefully this program will kick in very fast and change things very fast. In my opinion, it should. It's one of the best moves the government has made in this crisis so far. I wish everybody good luck. I will just remain in my methadone program. I don't want anything to do with it. I haven't had needles in me in many years, and I don't intend to. But I'm here, and just like my good friends who provided me some better, data right now, thank you very much. I love you guys, and I miss you, and everybody stay aware. Don't forget, we still have COVID out there, and also let's come together, and like we did with COVID, pretty much, let's come together and deal with this crisis right now, this overdose crisis in BC. Let's do it. One love.